Welcome to Leading Businesses, Leading Communities, a presentation of the Newton-Needham Chamber of Commerce. On this show, we try to highlight the businesses and the people that make our community strong. I'm Tom O'Rourke. I'm the president of the Chamber. I'm glad to have you with us today. And we have a really interesting show coming up for you with some great segments. First, we're going to be talking with David Naparsnek about the H1N1 virus that's commonly known as swine flu. Then we're going to go to Cabot's Ice Cream and meet Joe Prestigion, the man behind the ice cream. After that, we'll talk with Bob Kelly and Dina Rosenbaum from the Carroll Center about the Nonprofit Council, which is a new initiative of the Chamber. And then finally, we'll hear clips from the two finalists for mayor of the city of Newton. And then we'll hear from Lynette Best, who is the new program director at the Chamber. So we got a lot to cover. We're going to get right into it and start with our first guest, David Naparsnek, who is the Commissioner of Health and Human Services for the city of Newton. Welcome, David.
Thank you, Tom, very much.
Okay, H1N1 swine flu. I hear these terms interchangeably. Is there a difference? What's the story there?
Okay, it initially was called swine flu because it was thought to come from pigs in Mexico, and it's more formally called H1N1. It's a unique strain. Back in April of last year, it was quite severe in Mexico. It hit the United States and just spread rapidly through the U.S., through the northern part of the Western Hemisphere, over to Europe, and now it's called a pandemic. It's everywhere. So there's no difference between H1N1 and swine flu, but it's more likely referred to as H1N1. There is a difference, though, between H1N1, this pandemic strain that's been going on year-round now since April, and the seasonal flu, the flu that typically hits us in January, February, or March.
So my kids get the flu shot. That covers one thing but not the other?
Perfect. That's exactly the point. The flu shot, the seasonal flu shot that your kids get is primarily for kids, people over 50, people with health conditions. That's where the issues are. This H1N1 seems to be more of a challenge for pregnant women, for young children, and for example, in Massachusetts, in April and May and June, when we had the outbreak, the average age was about 14. So it's a disease that fortunately is not a severe disease, still a danger, but not a severe disease, but it's very communicable.
Yeah, I know I remember back then you heard a lot about schools closing and things like that. So I guess that's where the younger generation was.
Exactly. That was the population, and that's part of the population we're going to be targeting when the vaccine becomes available. Okay,
so that sort of leads to my next question. We heard a lot about it back in the spring and in the winter, and then it seemed to quiet down. I thought it was all over, but it's not.
We didn't know what to expect. We didn't know if it was going to peter out, which was our hope, but did not happen. And it went to the southern hemisphere. They were experiencing winter during our summer. And the southern hemisphere, it stayed very communicable, but relatively mild. I say relatively because people do get very sick, and some people have unfortunately died from it. But it is expected back. It's already hit some of the college campuses on the West Coast. We anticipate seeing in schools and in the general population. So it's here. It's something we have to deal with.
Now, I know we've worked together in the past on programs to get the word out to the business community about how to deal with pandemic flu and different situations like that. What should a business person be thinking, an employer be thinking right now about how to deal with this in the workplace?
Yeah, and that's very important because it will impact probably every employer in Newton-Needham. And so employers should be thinking in terms of what is their sick leave policy? Do they have a policy that will let a sick person or a person whose child or family member is sick stay home so they don't transmit the disease to other employees? So I think it's important for employers to look at their sick leave policy right now.
And that means not, like you said, not just the employee, but what's going on at home.
Exactly, exactly. Also, if an employee comes in with a fever, and the symptoms primarily are fever, 100.4 and above, body aches, cough, sneeze, if an employee comes in sick, send them home.
It's not a time to be macho and say, I'm going to fight through it and go to work.
Exactly. Nor a time to be a tightwad Scrooge and say, you stay and work till you drop, because you don't want everybody catching it. And then just protecting other employees, actually protecting employees and customers. Hand washing sounds so basic and so simple, and yet it's the most effective way. So make sure employers should make sure there's facilities available, sinks, soap, towels. If not, then something like a waterless hand sanitizer, make that available to employees. It's a message to employees that we care about you. It's a message to customers. We care about you, our customer, and you, our employee.
Sure.
Those are important. Something that young kids all do, and it's fun to watch. It's called sneeze or cough etiquette.
Yes.
And what it is when you cough, you cough into the crook of your hand, and that way you don't spread it. And that's how it's spread. Somebody coughs in their hands, holds something, types on a keyboard, turns a doorknob, and then the next person does the same thing, touches his eyes, nose, mouth, and catches the disease. That's why it travels very fast. But you don't have to sanitize or sterilize environment. Basically, routine cleaning, maybe more frequent cleaning of things that are touched a lot, like doorknobs, like keyboards, that sort of thing.
The little things add up to a lot.
They do, and that's, I mean, those are the most effective things, along with immunization. Now, the vaccine for the H1N1 is going to be coming slowly but steadily over the next few months. We'll be having clinics for target populations like pregnant women, like anyone who's a caregiver for somebody under 6 months of age. So daycares and families and whatnot, kids age 6 months to 24 years of age, and then people with a medical condition, underlying medical condition. The folks that don't
not necessarily everybody.
No, not necessarily everybody. Healthcare workers. I mean, and again, if employers are healthcare employers, they certainly have an obligation to protect their employees, and they should be well informed. If not, there are lots of good resources for people, for employers, for healthcare workers, for daycare operators. For that's been something that's been very, very, I think, very satisfying. Is the number and amount of information that's very, very manageable that's available. Two very good websites.
Where do we find it?
Right in Newton, we've set up a site, newtonma.gov/flu, FLU, no at the end of it, or flu.gov. Flu.gov is a federal website. Our website has information on things like where to get, there's a wonderful booklet employers can get multiple copies of flu care, what you can do to take care of yourself, your family at home, what's the difference between flu and a cold. Flu.gov has, for example, I printed this off of flu.gov. It's a poster that you can put up that just says, if you feel sick, stay home. Again, the idea of keeping the disease at home, not getting it into your workforce or spreading it to your customers.
Okay. So a lot of resources out there. If folks need to inform themselves, they can go to these sites, they can get the information. Employers can really develop a plan. I've looked at some of this stuff. You can really develop a plan for your workplace in terms of dealing with this.
And that's important because if this does, and we anticipate this will spread, and if an employer has a number of sick employees, he or she should have a plan. What am I going to do if some of my essential employees are out? How do I cover for them? So it's something, in fact, we co-sponsored a program with the Chamber on something called Continuity of Operations Planning. That was looking at a really severe, deadly flu, but this is going to be a flu that's going to impact operations. So people should know what are the essential functions that their operations have. Is it customer service, marketing, communications, IT? Is it financial, that sort of thing, payroll? They should have a plan for a backup plan should the IT, a large number of IT employees become sick. How do you continue your operation?
Sure.
And that information is on flu.gov.
Okay.
Health Department will be glad to assist any employer that has questions, that needs perhaps a little assistance in how to do these things. They're straightforward, but they're important.
Great. Yeah. It's not the end of the world, but it's not something to be taken lightly.
Exactly.
And we appreciate your coming on here to share with us information about it, on what people can do at home and in the workplace. And as always, I know your office is ready to help people, and we're working with you to help get the word out there. So thank you, David, for being with us.
Thank you, Tom.
And unfortunately, we don't get to go on this next segment, but we're going to take a trip outside of the studio here down to Cabot's Ice Cream with Joe Halpern interviewing Joe Prestigion. Cabot's is celebrating their 40th anniversary of serving ice cream to folks in Newton. So we get to watch just like everyone else, but off to Cabot's we go.